Yeah, happy Thursday.
Happy Thursday. So whoever joined in, we are having Dr. Jill Cyrus today, a veterinarian from the Carlson Animal Hospital. And I met Jill last year when I brought a bulldog to her that we took care of and had eye issues and skin issues, and she fixed them, as she did with Fernando. And we wanted to talk a little bit about today what I realized when I visited you with Fernando the other week, how great your hospital is dealing with this situation. So tell our listeners a little bit about how you're doing this.
Yeah, thanks, Anja. Yeah, definitely with the COVID-19 and everyone being on lockdown, it's really changed how we're providing veterinary service. We still want to be able to care for sick and injured animals during this time, but also try to restrict people's exposures and person-to-person contact. And so we're doing things a little bit differently at the clinic. We're just doing what we call carside service, which is a little bit different. People come in, they call when they get to the clinic, and we just come out, get their pets, bring them in. And the most of the interaction with the clients is over the phone. And so that keeps clients from having to interact with each other, very limited exposure to our staff. And it's a good way to protect both our staff and the clients and still be able to treat the animals. And then we're trying to do more over the phone too. If it's minor problems where we can just kind of talk it over or look at pictures or videos over the phone and then prescribe medications. We're doing that when it's appropriate. And then when the animals come in, we're just trying to limit that exposure to keep everyone safe. So it's been a little bit of a challenge as we work out the kinks, but I think it's worked out well and is a good way to still be able to provide the service that our pets need during this time.
That's true. And I was amazed that there was actually nearly no waiting time.
And
you were very really cute dog masks.
Yeah, we've been wearing face masks and personal protective gear so that when we do interact with the clients, it's kind of restricting that exposure that way as well.
Yeah, that was great. So I think as many of us face this problem having a pet at home right now in the pandemic, I think many people would like to know how you're supposed to deal with your pets during this pandemic.
Right.
And can they actually transmit the virus?
Yeah, and that's kind of the biggest concern for everyone is what is the risk to our pets? Are they able to get it? And because this is a new virus, the information is changing week by week as it is for people, also for pets. 2 months ago, I was saying, no, pets can't get it. But there have been a handful of cases where we have found it so far in the US, 2 pet cats and 1 pet dog. We still feel like it's a very weak ability to transmit from human to pet. They're doing diagnostic testing in a number of diagnostic labs in the US to see if they detect it in pets that are in COVID positive households. And 99% of those pets are coming back negative. So it still seems to be a very, very, very low risk. And so far, we haven't found any incidents where the pets can transmit the virus back to humans. So the pets shouldn't be at risk of exposure to humans. What really ends up being kind of a bigger issue for pets during this time is making sure that, they are still getting the care they need. They're going through a lot of changes just like we are. People are, their schedules and lifestyles have changed, which for a lot of dogs, that's great. They love having the extra time and attention from their owners. But with any changes in routine, that can be stressful for pets. So just trying to help keep on a kind of a consistent schedule for them and still manage that stress and manage the stress in the household is key. And then having a good plan for animals if people in the house should get sick. Again, we don't think that there's a huge risk for owners transmitting the disease to pets, but just to be safe, we're recommending if you do get sick to have limited contact with the pet. Ideally, the pet should still stay in the household, but have limited contact with anyone that's ill. But to have a backup plan if you're not able to care for them and keep them in the household. Where are they going to go? Who's going to take care of them? And make sure that you have, the veterinary service is available. They're up to date on vaccines when appropriate in case they have to be boarded. And so just kind of being aware of what what needs to be done if you have to make a change.
Okay, well, so far, if you're healthy, you can still kiss your dog, which is the good news.
That's right.
And the social contact, I think, is really an important part here. If you're single or you're home alone and you have your dog, at least you have some social contact, which we all know will help you with depression and boost your happy hormones. So it's good that we have them around right now.
I agree. Yeah, I think a lot of people are feeling sort of isolated right now. And I know for me, having my cat and my dog is huge, like kind of just a huge stress relief. And so, yeah, I think it's an important part of our lives right now. We're seeing a lot of people come into the clinic that are actually newly adopting and fostering, both because I think they want that interaction, but also they have the time to take care of them and train them right now. And so I think it's a good thing for both the pets and for the people to have that positive companionship.
That's true. And Fernando here even got a new position as chief tasting officer.
I bet he's good at that.
He's really busy.
Yeah.
But I wanted to ask you, why do patients right now come to your clinic? Is it more, do they do like normal vaccine checkups, or is it more urgent things?
We're trying to do more just urgent and emergency care, routine stuff, even dogs that, they're feeling okay, but they have a little diarrhea. A lot of that stuff we're trying to treat over the phone, prescribe medications. We have a online pharmacy, so people can order medications that way, or sometimes we can call those things into human pharmacies, or people can get it through other online pharmacies. But yeah, I mean, we're still seeing injuries, lacerations, foot injuries, dogs that are vomiting and not eating for more than 24 hours. They need to come in, and there's always that question, and people are worried. They are told to stay home, so they don't know, is it worth the risk of bringing their pet in? And so I always say, just call us or call whoever is your regular veterinarian and talk it out. Like, is this something I really need to bring my pet in? Is there anything I can do at home, or what I should watch for before I determine if it is an emergency? Yeah, just with any of those questions, just call and we can kind of help walk you through it.
Yeah, I felt like I had we had a little allergy shock with him the other day, and I felt like you really should know which veterinarian you can call and go to, because we ended up being sent away when we went to the closest one. So I feel
that's right.
Something that you should really check out. What do I do if something like that happens? So you're not like, oh, I'll go to my normal vet and they might be closed. And
yeah,
urgent cases. So
a lot of the primary care vets, I feel like, are having kind of limited hours right now, so that they may not have their normal schedule. And even the emergency clinics are limiting what they're bringing in. And so it's always a good idea to call first, or even in advance, like you said, so you know what the vets around you are doing in terms of hours and what they're seeing and what you should do if you have an emergency. Because yeah, a lot of times if it's a true emergency, you don't want to spend 30-40 minutes calling around trying to figure out where to go, and you really just need to get them in.
Yeah, Fernando ate a bee, so
yeah, yeah, I know. You have to go to like 3 different clinics.
That's not good. But what do you see now that we all know that many people adopt dogs right now and foster them, which is great. So I think we never saw the shelters that empty. But what do you see as a risk when we all go back to work? Like,
yeah, that's a really good question, Anja. Of course, we're always excited to see more dogs get adopted and for people to add pets to their household. But there is that concern right now. They have lots of time and attention to give them. But at some point, hopefully, we'll all get back to work and get back into a normal routine. And so, I think it's important for people to be aware of what the plan will be when they do go back to work. Are they going to be able to take their dog to doggy daycare? Are they crate training the dog? How are they going to deal with separation anxiety? It's a good time now even to sort of practice, give the dog some time either in its crate or alone, so that it doesn't think you should be around all the time, and then suddenly panics when suddenly you have to go back to work 8 hours a day.
That's true. That's good. And do you think we need to put a mask on our dogs?
I don't think it's necessary. Again, very, very low risk of transmission from humans to dogs. And then dogs to dogs. Right now, the AVMA guidelines are recommending dogs should go out for their regular exercise. It's good for them to get out in the sunshine, get their vitamin D, get their exercise. But they are recommending limited exposure to other pets. And I think it's more just a contact issue. I think you had mentioned on an earlier post that they can be a fomite, meaning respiratory droplets can get on the coats of the dogs, and that could in turn transmit to humans. And again, we haven't seen a lot of that, so we don't know how big of a risk that is, but just to be as conservative as possible, limit their exposure to other pets when you're out and about with them. But I don't think they need to wear masks.
Good. That's good news.
Yeah. Some of them would do better than others with that.
But also, would you recommend to boost their immune system right now? Like, we all are all about health and eating good and healthy, being out exercising and trying to boost our immune system. Wouldn't we do the same with the pets right now?
I think it's a great idea. And especially a lot of people are dealing with a lot of stress, and the pets feel that. And so they're under stress too. Even if they're happy that we're home, they sort of feel that stress, and that's hard on their bodies and their immune system. So definitely making sure they're on good nutrition, they're getting good exercise, good rest, and then any ways to help reduce the stress in their environment. And then things that are good for immune boost, like I know your product, as well as being good for joints. It's going to help with skin and hair coat and immune system, and I think that's all beneficial.
Yeah, that's good. I didn't mention that our audience is welcome to ask any questions. If you want to ask Jill any questions, or us, or Fernando, how he likes this treat.
Yeah, Fernando might have better answers than me.
Well, he certainly enjoys treats. And he's very happy that we're home all the time. So that's
he seems to be dealing well with it, I would guess.
He doesn't seem to be depressed.
Good.
Which is good. Do we have any questions, Brian? Not yet. Well, I guess people are aware of everything. But I wanted to talk to you more about the positive effect of having a dog. Like, we always want to know more about why we have such a great bond with our dogs. And as a scientist, I always refer to the hormone levels, because you have oxytocin as our happy hormone, and it's proven that if the interaction with your pet, it goes up and it reduces your stress level. And I feel like many more people should understand, like, just petting your dog if you're really, really stressed will just naturally lower that. Which is fantastic.
Yeah, I agree. Like you said, oxytocin, the same hormone that lactating moms release, that has a calming effect on them and their young. We'll see the same mimicked when we're interacting with our pets.
Yeah, I think we got a question, but
okay. No? Oh, something about allergies.
Allergies.
Yeah. So it's from Madwell 94 and Mr. Wallace 72. Does your product help with allergies and itching?
So I think they're referring to Happy again. Our product, yes. As Jill mentioned, our product is really good for skin, and due to the hyaluronic acid, it moisturizes the skin, which is often the reason why they itch, especially in the dry climate. The dog get really dry skin and they start to itch, and it's just, that is something that Happy again is helping with. Yeah.
We have another one from Larry Melanie. Suggestions to ease a dog into our changing schedules, especially newly adopted dogs?
Oh yeah, very good question. I think the best thing is, even now when we've got an abundance of time, trying to maintain a fairly consistent schedule for dogs, I think helps them kind of know what their expectations are. And it's not a bad idea to kind of have a schedule that you're going to be able to keep. Obviously, you won't be walking them 4 times a day necessarily when you go back to work, but if you can plan a couple of those walks morning and night where you'll be able to maintain that as you go back to work and don't have as much time, then as your schedule changes, you'll be able to maintain a lot of those same aspects, and it'll be a little bit less kind of stressful for your pet as they adjust. But yeah, trying to plan feeding times around when you'll be able to do at least similar feeding times when when your schedule changes, walking times, exercise and play times, and kind of just keeping that in mind as you interact with them.
Yeah, that routine, that is good. I also think, getting back to work, there are a lot of workplaces right now where you can bring your dog, and maybe that's a good conversation to have now, to ask your employee to bring your dog to work, try it out.
Yeah, exactly. Or look into daycare. I know some dog daycares are able to be open right now, so it's not a bad time to start looking around what's in your area and what they offer and what their rates are, and see if that's something that's going to work well with your schedule.
That's true. Yeah, and there are many really amazing dog walking services as well.
So. Oh yeah, very good point.
Yeah, I think also one really new great company that we work with is Dog Drop. They have a daycare. I think they first opened in downtown, and they offer just hourly drop-offs. If you're working, maybe you want to go to happy hour after work and you have your pet with you and you cannot bring him to the restaurant, they offer like a membership club, which is also great.
That's so cool. I haven't heard of that. Yeah, that sounds great. Yeah, and then just interact. They probably interact with other dogs, right, during that time?
Yeah, exactly.
So they get.
We have one more question for you, Joe.
Oh yeah.
That's a veterinarian.
This is a question for Jill from Mr. Wallace 72. Any tips on helping dogs with bladder issues like stones and dehydration?
Yeah, definitely with those types of things, I do recommend going in and seeing a veterinarian, especially with a history of stones. Male dogs, especially, stones can be very, very risky. They can try to pass them, and then they can end up with an obstruction in their urethra, and it can be a little bit of an emergency situation. But aside from that, if it's just a history of stones in the past, I do recommend usually increasing their water consumption is going to be good, regardless of the type of stone. So adding a canned food diet will help with that. And then usually I do recommend one of the veterinary prescription diets to help maintain bladder health and the urine pH, so they're less prone to forming new stones and crystals in the urine. And your veterinarian can help you decide what's the best diet, but Royal Canin and Hill's prescription diet have some good prescription diets for urinary health.
That's fantastic. I get a lot of questions about skin, I see here. So if you want to look into that, like our product is mainly out of collagen. Collagen is known to be really good for skin and joints, but we adding hyaluronic acid and the vitamins, so it moisturizes the skin. And we will write some, we put something in the bio. Do you say that? Yes. Good. Any more questions? What are you doing with your dog right now? Because you're still working a lot. So
yeah, she's loving the new schedule because my husband's working from home and then I'm still working at the clinic. And so she'll usually come with me into the clinic in the morning. She likes to see the veterinary staff. That's her second home. And then she likes to watch the dogs that come back. And then in the afternoon, I'll usually bring her home and she'll spend the afternoon with my husband and help him with his Zoom meetings, which I'm sure she helps a lot with that. But I think she likes it. She likes kind of having she likes getting home where she can just bounce around. And she's actually here now, but I think she's entertaining herself.
Well, I'm keeping Fernando busy with his treats, so.
I think he's living up to his title well. His new title.
Yes, right.
Yeah. Tell me, Anja, does Fernando take Happy again?
Oh yeah, he does.
Silly question.
He's only 2 years old, but as you know, bulldogs are really torn to having joint issues and skin issues. So he's on Happy again, preventative. We have a new version for our young dogs and puppies, so it has a lower dosage. But
oh, great.
I
haven't started my new pup Penelope on it. She's about 8 months, but she's very active. She likes to run and jump, and so I probably will start her on it. I did use it for my last 2 dogs who are older and arthritic, and it really seemed to help with their mobility. That was after we met. I was excited to find a product that was so collagen rich and with the hyaluronic acid, and be able to recommend that to my clients with pets with arthritis as well. And I always forget about how it can be helpful with skin issues too, which is nice.
Yeah, and it's also good for the lining of the stomach. So we also say that if you have digestive problems, and the vitamins boost the immune system. So it's an all-in-one really good solution. But the puppy version I recommend because it's in their growing phase. Like our kids, you always want to give them the best when they're growing. So
great. Yeah, I'll have to order that for Penelope.
Great. Do we have more questions?
One last one.
Yeah.
For Mr. Wallace.
Okay.
Dog keeps biting at her paws. Any specific reason why she may be doing this?
So two of the most common things that are going to cause a dog to chew at their paws: allergies, and it's very non-specific. It's really hard to differentiate between food allergies and environmental allergies. But some dogs will kind of chronically lick and chew as kind of the obsessive compulsive disorder. If he's biting and chewing, it sounds more like there's an itchiness component, and so I'm thinking that there's more of an allergy component. Yeah, a lot of dogs will do great with something like Happy Again or fish oil supplements, but there may be something where we need to change the diet in case it is a food allergy, especially dogs under 2 years of age. Probably 70% of those dogs with allergies, it ends up being more often a food allergy. But in this area, we do see a lot of environmental allergies too. So it'd probably be good to take them in, get it looked at. If there's a lot of redness and inflammation, that fits with allergies too. There are some medications and treatments for that. Ideally, though, we try to control these things with diet, supplements if we can, and grooming sometimes helps, and sometimes even soaking their paws after they come in from outside, or there's some medicated wipes that'll help get pollens and allergens off of the paws, and it'll help a little bit. Do you have anything to add to that, Anja?
I saw it only from a friend of mine when a bulldog really got depressed and bored because they were just not home. That could also be like more of a emotional component as well. But
yeah, no, definitely.
As everyone is home right now, I don't think that's the reason. So
yeah, no, and sometimes too, the chronic paw licking will be a self-soothing behavior, and like you said, a way for him to deal with stress or boredom, and so kind of consider that as you're assessing the situation, if that might be what's going on.
That's true. Yeah. No, I mean, we sometimes forget that these great animals are giving us the stress relief, but we should also take care of them to have fun exercises. Maybe even we did some brain games with Fernando where he has to find things. And
oh, good. Yeah.
Keep him a little busy and not only exercise and walking and playing.
Yeah. Something to get them thinking. A lot of dogs like having a job. And so finding something that gives them that sense of purpose seems to make a big difference for them.
That's true. Bulldogs have they love the job of eating. So I think they found the perfect job.
Just make sure they don't become overweight. Yeah.
That's true. Well, we're keeping him on a strict diet. He's
eating
only
and
eating
exercise,
really good treats.
Yeah.
That's true. Do we have more questions? I want to mention again for the people joining us now how great service you're doing at the Carlson Animal Hospital, because
thanks, Anja.
It was really sad. I mean, I think now many people adapted to it, but when I got to you first, I've been to other 3-4 different veterinarians when I had that emergency thing, and none of them did what you did, like that you wait, you call in, and it was great. It's really fantastic service. And even after this might be an opportunity for people to avoid the wait time, because it was just
it's funny that you said that. The first couple of weeks we started doing it, people were loving it because they didn't have to get out of their cars. They could just keep listening to their podcast or their radio, and I think they kind of liked the door-to-door service. That they didn't have to come in and check in and deal with all of that. I think some wait times are longer than others depending on how busy it is, and as the days get hotter, we're trying to be conscious about that because we don't want people cooking in their cars. But a lot of people are kind of enjoying the ability to just kind of drop off and come back later, or if it's just a 10 to 15 minute wait in their car, then they love it.
Yeah, and you avoid the the contacts in the waiting room are not always positive with the dogs, like when they
Yeah, exactly. And that's
always
one
fun.
thing where I think that's why our clients do like it. We have kind of a small waiting area, and so I think it can be stressful for the pets and the owners coming in and dealing with that. And so I do think that a lot of people are liking it better than the normal routine.
So there's some positive takeaways from this.
Yeah, exactly.
That we might incorporate in our future routines, which is great. Also the more frequent dog walks. Like I see so many more people out with their pets.
Yeah, me too.
It's great to see, because sometimes you just have a garden and you might think like just let them be, but the walk and the exercise is so important for bonding with your pet and giving them, like you, the exercise they need. And I think that's something that we should bring into our future routine. Have routine walks, morning, evening, if possible, even lunch, and have them get some playtime, find a good dog park where they can really run, chase a ball, and if possible, even go to the beach. There's a great dog beach in Newport Beach. So.
Yeah, no, I think that's key, especially like you said, the bonding time. Like, yeah, it's easy to just let them run around in the backyard, especially if you have multiple dogs, but it's not the same as them kind of interacting with you and having that playtime and walking time. And it definitely strengthens the human pet bond that we'll see in that companionship.
Yeah. Let's see another question about immunity. Yes, happy again does help with immunity. We have all vitamins in it, vitamin C, E, D, and also the collagen and hyaluronic acid is just really good for the system. So I always recommend it preventative and to boost the immune system. Yes. And by the way, we all take it ourselves too. It's human great. Oh, now Fernando is tired. Break. Great. Well, it was great having you, Jill, and talking about all these really important subjects. We also will send out a blog to all our followers afterwards to recap this. But what we get away with is that our dogs, we can still kiss them, we can still be in contact with them and love them, and we don't have a really high risk of them transmitting the virus. They don't need to wear a mask, and we just have to enjoy the time that we have right now with them, because it's probably never going to be that much.
Yeah, to think of it as to take the positive out of it for sure.
Yeah, perfect.
All right, thanks so much, Anja. Thanks for having me.
Thank you. Bye.
Bye.